Welcome back. Well, Health Minister Dr. Zweli Mkhize has presented a 10-point plan to improve healthcare and support the implementation of the National Health Insurance. Dr. Mkhize presented his department's budget vote a short while ago. The Health Department's budget for the 2019-2020 financial year is 51.46 billion rand.
Shortage of staff is the second problem. We believe that the shortage of staff in the frontline service delivery needs to be eliminated once and for all. We've identified the shortage of staff. That require attention. So of the 4,143 medical officer positions, we are ready to fill 2,680 of those this year. And then, of course, a proportion of the nurses, allied professions, and community health workers that have to be also given attention. We give the figures in the detail of the text of the numbers that we think can be accommodated. But to be able to do this, we've actually instructed our departments to go and look for possible sources of funding to divert to this particular priority. And therefore, the Department of Health and Treasury now have got a team that's working on reprioritizing the budget, looking at vacant posts, looking at structures that are bloated, that need to be downsized, looking at projects that need to be abandoned, and also looking at restructuring conditional grants. All of this we'll report as we move on, but effectively we're looking for alternative additional sources of funding. And mind you, I've said that even the original baseline does need to be looked at. That of the issues is the supply of medicine. I also believe here that we need to give this attention. Budget for medicine needs to be ring-fenced and protected to prevent drug stockouts. So we are looking at an app, a mobile app, which will allow immediate reporting by patients and civil society every time that vital medication is not available in clinics and hospitals, so that there's a quicker feedback to the management to correct the situation both at provincial and at national level. We have also identified situations where there are global shortages. We will always endeavor to ensure timeless alternatives that must be supplied so that people don't go without any medication. The South African Health Products Regulatory Authority will also be strengthened to ensure that they speed up the registration of medicines and also build up capacity for local production of active ingredients, as well as removal of application backlogs and accelerate the applications to make it easy for drugs to be accessed. We're also exploring procurement of available software to ensure that we can actually dispense medication closer to where the patients are. And we're partnering with NGOs that have already done work on this particular area, focusing on the areas of townships, informal settlements, and rural areas. There are areas already where we are able to get medication delivered without patients having to go to hospitals. This again will assist to reduce the patient waiting time and people just walking to the hospital just for medication. The impact of these steps that I've indicated will be that of reduction of patient waiting time, less overcrowding on hospitals, and managing patient workload for both staff in the clinics and hospitals, and ensure that our people have medication without the inconvenience of unwieldy queues in the hospitals. The other issue to focus on is that of quality improvement. Here we welcome the reports by the global and local and national Lancet commissions on the quality of care. The quality of care in the government-run facilities must improve to make the public sector a service of choice in terms of access, affordability, availability, appropriateness, technical competence, skills, effectiveness, respect, and caring, amongst others. So when people approach our public sector, they will be doing so because it's their service of choice, not because they've got no other way to go. We will therefore be using the Office of Health Standards Compliance to monitor the improvement of quality at different levels. We'll also be working on client satisfaction surveys to track some of the very sensitive issues which we believe that management needs to be alerted quickly enough to be able to ensure corrections, such as quality of food, linen, hospital linen, cleanliness, attitude of staff, etc. All of these for us are non-negotiable, for which we need to make sure that we partner with advocacy groups, with civil society, with our patients or our clients in ensuring that they give us feedback to help to correct the system. Then, of course, we want to strengthen the office of the ombudsperson, which is a channel where communities can raise concerns about the quality of health services. This one we will strengthen, and also we're going to work on a combined strategy of improved clinical care, efficient administration, backed by strong legal interventions to reduce medical legal claims by more than 50%. The fifth is improvement of governance. Here we intend to strengthen leadership at various levels to bolster service delivery and place the patient at the center of care. We'll review organograms and also look at bloated, inappropriate structures and adjust delegations and ensure that there's authority at the correct levels for effective decision-making processes. And that way also fight corruption and promote ethical leadership and eliminate wastage. Consultation with the heads of specialist disciplines will be undertaken to strengthen clinical guidelines at tertiary and regional hospitals to ensure that we build capacity for all the managers and strengthen the system. To improve governance also at our health facilities, we'll ensure that clinic committees and hospital boards are up and running by the end of this year. These structures will be trained so that whenever these feedback mechanisms begin to kick in, they are able to effectively assist management of a clinic or a hospital to make amends and correct the system so that the patient service is improved. Sixth is infrastructure build. Here we believe that for the public to believe in NHI, the quality of the infrastructure has to be improved. Currently, there's 19 billion which has been set aside in the MTF to refurbish a number of hospitals and build new hospitals at the same time and clinics. But this is a lot of work that's been done, but we also believe it's not enough. The department at the moment has actually done a whole cost analysis and audit of the quality of the services and the cost it would take to revamp literally every hospital or facility in the country. So I've set up a team of experts in finance, health, and health infrastructure from Treasury and Health to seek creative financing mechanisms and alternative models of delivering health infrastructure. We've given them a clear directive to look at a program that can actually start delivering literally refurbishment of all the hospitals and building new ones within a horizon of 5 to 7 years. Now, this is the basis on which the NHI will be operating. Our current preliminary indications are that such is feasible, and therefore we're going to work on a plan that once it's developed, we will then be approaching provinces and all other stakeholders to ensure that we can start that massive infrastructure build.